In this video, we are talking with Lori Hartley, and Lori is our Director of Nursing for Pea Ridge Schools, and we appreciate you being here as we return to school, and everybody is looking forward to the school year, and we're just a couple weeks from beginning. I think, Lori, probably the first thing, this is a curveball for you, we've got some new nurses coming on staff. Would you just talk briefly about our new people?
Absolutely, yeah. We have 2 new RNs that we're adding to our staff. We're going to have a new RN at the primary building. Our nurse there retired, so we have a new one coming on, and then we have a new RN coming up to the middle school for grades 5 and 6. So they'll be starting with us soon.
And we have a nurse in every building, and so all 5 buildings are covered, and Lori kind of leads that group and does a fantastic job for us. So what we're doing is kind of answering the frequently asked questions that we're seeing throughout our website, concerns that our community has, and so we're going to get right to it if that's okay.
Sounds
so
good.
As we return to school, from a nursing standpoint, from a health standpoint, what can parents do to keep their children healthy as we're returning to school?
Yeah, so parents really can play a huge role in helping us keep their kids healthy. Number one, I would just follow the social directives that we've been given from our state level. Wearing the mask, social distancing, encourage frequent hand washing. That's super important. Wash your hands after you go to public places, whether you're just touching a door handle or a gas pump, the whole family can do this. Shopping carts, any electronic devices where you swipe your card in and out, make sure you wash your hands right after that. And until you get a chance to wash your hands, don't touch your eyes, your nose, or your mouth, because that's how the germs can get into our body. And so just being really mindful about, keeping those hands away from your face till you get a chance to wash them. You want to wash your hands before you and after you eat, of course after using the bathroom, after blowing your nose. And then if it's soap and water isn't available, hand sanitizer is a great second. Hand washing with soap and water is the number 1 priority. You want to wash for 20 seconds or hum the happy birthday song twice. Hand sanitizer, you want to apply a good amount, rub it for 20 seconds until it's completely dry. So that's a second alternative, but hand washing with soap and water is the best.
One of the things that the school district has done this summer is every classroom will have hand sanitizer available within the room. And so in all of our buildings, all of our rooms, to Ms. Hartley's point, if we can't wash our hands or get something done, we will have hand sanitizer readily available everywhere. And so that's something that we've added over the summer. As we come back to school, the district recognized it's very difficult to screen students, 2,200 students every morning. And so we're partnering with parents and asking them to screen students at home prior to getting on the bus, prior to dropping students off at school. And so would you talk through parents screening their children at home and kind of what to look for when they're making the decision of, do I send my child to school today or do I need to keep them home?
So some of the things that you can look for when you're screening at home, I would just recommend a morning temperature check for everybody in the household. I think that's a really great place to start, before they come to school. Obviously, if they have a fever, they would need to stay home. There's so many symptoms we're learning with COVID, especially with children. They can range from really mild to more severe. So if they complain that they're chilled, hot and cold, cough, definitely shortness of breath, headaches, body aches, new loss of taste or smell is something to look for. A lot of congestion, runny nose. They've also seen some nausea, vomiting, and diarrhea in some of the COVID cases. A funky rash in some of the COVID cases. So there's really a lot of things. As parents, we know our kids the best. And if you don't feel like they're up to 100%, maybe decide to keep them home that day and then kind of go from there and have them take a little bit more time to see how they feel throughout the day. So,
one of the questions that we get asked over and over and over is, if a student is sick in class, and kind of what will happen, and what the procedures are for getting the student to the nurse and then making decisions of whether we send students home or whatnot. So would you talk about if a student is ill in class, kind of what the process and procedures would be there?
If a student isn't feeling well in class, we actually have an algorithm or kind of a flow sheet that we've been given from the state level. They would be sent to the nurse, and we would kind of determine their symptoms. If they were running a fever, or had other symptoms that we thought were concerning, they would be placed in an area within the nurse's office that's clearly visible from the nurse, but it's isolated. And then the nurse would don the proper PPE gear, gown, mask, gloves, anything that we might need to protect us if they did in fact have COVID. And we would notify the parent. We would also provide them with information on where they could go to be tested and kind of how that would work. And then the school nurse would do a follow-up the next day, determining whether or not they were tested and if they recommended quarantine for them until we got the results. So every case will be a little bit different. The doctor may decide they don't need to be tested. But yeah, they would just come to the nurse, be isolated, make sure we had everybody protected and separated from well students that would be coming into the office.
And you mentioned some of the changes that we've made to our nurses' offices.
Yes.
And so would you talk briefly about some of those changes for the community?
Yeah, I'm really excited. We actually were able to increase the size of a couple of our nurses' offices. Some of them were already plenty big, but we've got some new offices now that allow us to distance and partition off areas for whenever we have sick kiddos that come in, so they can be at a safe distance with a plastic sheeting between them. And because we will still have well students coming in daily for medications and different things, so we were able to find spaces within our district to accommodate the recommendations to have them separated and have a barrier in place.
If we have a student that is ill that we've seen within the nurse office, they'll be kind of sectioned off, cornered off, and they'll have a space to keep them under our supervision, but also kind of isolated from the regular traffic that our nurses see on a daily basis, so that everybody remains safe and healthy.
Exactly.
What happens if my child has a fever at school and the recommendations that might be coming towards parents if a child is detected with a fever at school?
Kind of similar to what we talked about before, the teacher would send them up to the nurse. We would automatically check them out. If they determined, if we determined they had a temperature, we would put them in their little isolation area, still visible by the nurse so that we can be right there to assist them if needed. Immediately contact the parent. We would then provide them again with the information on COVID testing and follow up with them the following day. They would be asked to go home, and that's kind of one of the things that we're dealing with that we'll be dealing with, I think, is sometimes we're going to have kiddos that just get a regular cold and it's not COVID. It'll be a little bit of a learning curve for us determining how to handle that, with what's a cold and what's COVID. And so yeah, but basically if there's a fever, and that's always been our policy, if they have a temperature, they do get sent home. The rule is 24 hours fever-free with no fever-reducing medication. If it is determined that they need to be tested for COVID, then of course their time out of school would be a little bit longer. Those are excused absences, and so I don't want parents to worry that if they're a little worried and they keep them home, we will make it an excused absence.
Last question, is there anything, for our student, staff, community, as we get ready, coming back to school and starting again here in August, is there anything from the nursing department and health standpoint of our students and our teachers and our staff, anything that you'd like to share that maybe we didn't cover?
The privilege here at P Ridge to care for and educate about 2,200 students. We take this privilege and this responsibility very seriously. We may err on the side of caution somewhat more than we normally would, just because we do have so many kiddos that we care about, and we want everyone in the district, their families, everyone to be as safe as possible. So we just ask for patience and grace during this time as we're going through a period that's new for every one of us. We've never dealt with this before. We definitely encourage open communication. If you have a question for the nurse, don't hesitate to call the school. You can call your school nurse directly. You can call and speak to me. We want to have an open line of communication always with our parents, and just know that we're here to keep your kiddos and your families as safe as possible. We have that in mind, and we know what a big task and responsibility that is, and we just want to make sure we do the best we can.
I thank you for coming and seeing us and joining us today. We're looking forward to having students back with us soon.
Yeah, me too. Thank you so much.